Dr. Rohan Krishnan, patron, FIMA, that's Federation of All India Medical Association, and former chairman for Anti-Harassment Cell of FODA Doctors Association. Rohan, a very warm welcome to you. We're looking at this case yet another time. We've seen similar instances take place, and let alone this is happening after the RG Kaur incidents. Your first and initial thoughts? I mean, doctors' safety needs to be paramount. They're the people who are taking the hypocritical oath for the rest of the citizens, aren't they?
Yeah, exactly. It is shocking that every day something new is coming up for doctors, and some new cases of harassment at the highest level. RG issue was one of the biggest issue of the country during that time, and now you see that another incident has happened, and it is also a very serious incident that the killer were actually the came as a patient, and then they have stabbed the doctor. So where is the safety for doctors that we are demanding from quite a long time? Where is the protocols which is there for maintaining the safety and security of the healthcare staff who are working? What is the point of taking all this hypocritical oath, studying for 10, 15 years, and then going to treat the patient in the country where there is no safety? So if these things and incidences continues, people will lose interest in the field.
No, you're absolutely right. In big signages at various hospitals, it's quite in bold capital letters. It's written that attempting to attack a doctor is going to surmount to a non-bailable offense. But in terms of preventive measures, are there any steps being taken across any platform, be it a government hospital or let's say, a real top-class private hospital? What kind of preventive measures are in place today's time, Rohan?
Exactly, that is the whole point, that apart from just discussing all these things and writing on the walls, no serious preventive action has been taken till now. In all the hospitals there should be proper metal detectors, there should be guards who checks the patient that they are not coming with such kinds of weapons which could damage not only the doctors, but also they can be a threat to the patient. Recently another incident was there in Delhi where a patient was shot in the ward, in the hospital premises, and he was admitted in the ward and he was shot. So every day we are coming up with some kind of cases like this. So we have to maintain our new rules, our new setup, and a new system to check this. Otherwise, it is going to be a complete mayhem and atrocities.
No, you're absolutely right. Just to tell the viewers as well, Rohan, we're getting some live visuals of the Deputy Chief Minister of Tamil Nadu, Udhanidhi Stalin. He's made his way, I think, going to go visit the doctor inside the ICU. The Health Minister, Ma Subramanian, also there at this point in time. But, Rohan, it doesn't have to be always a metal detector. It doesn't always have to be like a metal baton, a gun, God forbid. But the risk of workplace violence and its effect on doctors' mental health and job satisfaction in the first place. I mean, I don't want a doctor who's not mentally fine or feels safe to go and attempt to cut open somebody else's body or operate on somebody else.
No, I'm glad that you raised this thing. This is one of the most serious issue that we have to consider, which we have to ponder upon. That if I am feeling that a patient who is serious might survive or might not survive under my treatment, so I will choose the option that it is better to refer the patient from this hospital to somewhere else. Better he dies in the ambulance than to die in the hospital. I think that it is very sad to admit this, but if you are doing something like that every day, then there is a lot of mental pressure and harassment among the doctors, that they feel that if they take some risk on part of patient, the trust between the doctor patient is lost. And if now I take a risk on the part of the patient, I think that they are going to blame me. So it is better that I tell that I'm not expertise in doing this. I'll send you to some other hospital and you go there. It is inhuman on one part, but at the other part you have to understand that why this is happening. Like if you see that 30, 40 years ago, the respect, the reputation that the doctors were having, the general sympathy of the public that the doctors was having, that was very satisfying. That is why doctors were never asking for a pay grade to increase their pay or anything like that, because the job satisfaction was much more 20 years back. But now with the advancement of the medical sciences, now with the advancement of everything, there is a general perception has changed in the public. Also, then there are some doctors and the healthcare workers on the big corporate hospitals who are responsible for that. I'm not going to deny it. It is not a complete black and white, it is a shade of gray. But however, even if 10% people are bad and 95% people are getting harassed by the other patients, then obviously the 100% patients will suffer because no doctor will try to take any serious case when it comes to their hospital, be it a private or a government one.
Right, and I'm glad you said that this is a shade of gray because, and that's why I don't necessarily want to talk about the government and the institution's role, but you know, bodies like FODA, FIMA, and when you're studying in all these prime medical institutions, do medical institutions teach our future doctors how to handle volatile situations like these? Is there proper training that goes into it? Because I certainly see, Rohan, that there is a dire need for it.
Yeah, obviously now they have put in it in the guidelines. 10 years ago that was not there, but now there is in the guidelines. And also in our college, in Maulana Azad Medical College, we had the ethical programs where we used to teach the doctors also, like how to treat the patients, how to talk to the relative, how to break bad news. But you have to understand that one of our professors used to say that you have food for 200 people and you have to serve 2000 people. So that is the reality of the government sector in the country, that the patient load is much more than what we are prepared to do. So you cannot expect someone to have a proper counseling of 40 minutes. That is not that, because I'm not treating 4 or 5 patients a day. If I'm seeing 200 patients a day, then I cannot give you more than 5 minutes of my time. So this is something which is a failure on the part of the government and the entire system, that our PHCs are not strengthened, our community health centers are not strengthened, our primary, secondary healthcare centers, our tertiary hospitals are not strengthened. All the loads are coming to the big medical colleges and the oncology centers, and that is why there is gross insatisfaction among patients. If I go to my hospital today and I see that they have to wait in a queue for 3 hours, even I will get irritated, and I will feel that we have to do something about it.
Right.
But right now, what organizations are doing are continuously telling that we need to recruit more doctors in the government sector. We need to improve the system. But it seems that it is going to deaf ears.